Welcome to Jackson County Memorial Hospital. Thank you for choosing us as your guide and partner for your orthopedic care. This educational video will prepare you for your joint replacement surgery, giving you the information of how to prepare for your surgery and the knowledge of what to expect afterward. As you go through the surgical process, you can refer to this video as many times as needed if you want a reminder of the steps. Also, we encourage you to share this video with your family or support persons so they also know what to expect throughout the process. Once you and your doctor have decided that surgery is needed, the doctor will go over the risks and complications with you, as well as discuss any pre-op clearances you may need from your primary care and/or your cardiologist. The nurse will work with you to choose a surgery date. Our nurse navigator is a position that is an extra step to provide a steady point of contact to ensure there are not any gaps in the process from the time the patient meets with the surgeon and the patient arrives at the hospital for surgery. After surgery is scheduled, you will have a designated appointment with the nurse navigator that will provide a great deal of education. This visit is lengthy, but goes over the patient's medical and surgical history and discusses the joint replacement procedure along with preoperative and postoperative expectations. We also offer a joint replacement education class. This education class will give you an in-person opportunity to learn about your surgery and what services and equipment you may need when you are discharged. Once surgery is scheduled, our centralized scheduling representative will call you to get your information updated in our system. This information includes insurance and financial arrangements. If you have pre-surgical lab work or EKGs, it will be scheduled at this time. To check in for these appointments, go to the main admissions window and bring your insurance card and a photo ID. The nurse will call you before your surgery to discuss any medications that need to be discontinued pre-op and answer any questions you may have. The afternoon prior to your surgery, a member of the same-day surgery team will call to notify you of your arrival time. Your arrival time will be approximately 1.5 to 2 hours prior to your planned surgery time. On the day of your surgery, check in at the admissions window. Then go to the second floor to same-day surgery. At the same-day desk, you will be taken to your pre-op room and change into a gown. A same-day surgery registered nurse will then take your vital signs, review your medication list for any changes, and start your IV. The nurse will also tell you about the OR Big Board that will help keep your designated caregivers informed of your progression throughout the day. Approximately 30 minutes prior to the start of your surgery, you will be taken to the operating room holding area on your stretcher, and your caregivers will be taken to the waiting room. While you are in the holding area, you will meet your anesthesia provider and a nurse from the operating room. You will visit with your surgeon, who will confirm the location of your procedure and mark the surgical site with his or her initials on the operative limb. Prior to your receiving anesthesia, if you have any questions or concerns about your procedure, please ask. After surgery, you'll be taken to the recovery room to be monitored by a registered nurse for approximately 1 hour. As you awaken from the anesthesia, you will have heart monitors, a blood pressure cuff, and oxygen connected to you. If you are in need of pain medicine or you are feeling sick, let your nurse know and we will do our best to make you comfortable. When you leave the recovery room, you will be admitted to a private room. You will have a lot of departments involved in your care team, which will include RNs, LPNs, CNAs, respiratory therapists, and physical therapists. Immediately after coming to the floor, we will monitor your vital signs. Your pain level will be monitored frequently. You may have oxygen and a catheter. You will be instructed to do breathing exercises with an incentive spirometer. Treatment of your pain is very important to us. You'll receive pain medication via IV or orally. Our physical therapy team will be there to assist you in getting up and walking in the halls once or twice each day. You should expect to be up walking either the day of or the first morning following your surgery. For knee replacements, physical therapy will set up a continuous passive motion machine called a CPM. This will keep the joint moving so you will have improved function. It will be applied intermittently during your acute care stay. Your physician will be in control of your care while you are a patient at JCMH. For other joint replacements, there will be other specific therapies for healing. Prior to your discharge from the hospital, you will be visited by a discharge planner. The discharge planner will work with you and your physician to make certain you have the equipment and any follow-up care your physician feels is needed. This could include transfer to a skilled nursing facility or a swing bed facility, discharge home with home health care and physical therapy, or outpatient physical therapy services. Following discharge, you will be referred to continue physical therapy to assist with rehabilitation of your joint replacement. The physical therapist will create a program that strengthens your joint to assist with regaining function and range motion. The plan will be customized to each individual. Your participation in physical therapy is essential for optimal healing. We help instruct patients on the use of equipment and assistive devices. Your first follow-up visit will be 2 weeks after your surgery to check the wound, remove staples, and see how physical therapy is responding. Thank you for choosing Jackson County Memorial Hospital for your orthopedic needs. Be sure to follow your surgeon's instructions after surgery. Our goal for you is improvement in the activities of daily living. Taking care of your joint replacement and general health are important ways you can contribute to the final success of your surgery. If you have questions, call the JCMH Orthopedic Clinic at 580-379-6500.